Can a sleep apnea test done at home really replace a sleep lab? A home sleep test is convenient and cheaper, but for some patients, it can miss the diagnosis. If your home sleep test is normal, that does not always mean you are in the clear. Many people are given home sleep testing, but it is not a right first step for everyone. The best sleep test depends less on convenience, more on choosing the right patient. So, in this video, I'm going to discuss in very simple language what home sleep apnea test is, how effective it is, whether it should be used initially for all patients, and pros and cons compared to a full sleep lab study. Hello, everybody. I'm Dr. PK. Let's break this down clearly. A home sleep apnea test, also called HSAT, is a simplified sleep study that lets you do this test in your own home. Most home sleep tests measures things like airflow through the nose, breathing effort, oxygen level, and heart rate. Some devices also track body position and snoring. Here's the key point. A home sleep apnea test is mainly diagnosed to look for obstructive sleep apnea or OSA. That is the condition where the throat repeatedly narrows or collapses during sleep, causing breathing pauses, drops in oxygen, snoring, restless sleep, and daytime fatigue. The American Academy of Sleep Medicine says that HSAT is an alternative to polysomnography, which is a full in-lab sleep study for uncomplicated adults who have signs and symptoms suggesting a high risk of moderate to severe obstructive sleep apnea. So yes, a home test can work very well, but only when situation fits the tool. How effective is HSAT? For the right patient, HSAT can be very useful. Home sleep apnea test. If someone has a classic story of loud snoring, witnessed apnea in breathing, obesity, daytime sleepiness, morning headache, high blood pressure, thick neck, or crowded airway, then HSAT can often identify clinically important obstructive sleep apnea fairly well. AASM guidelines supports its use in adults with symptoms pointing to an increased risk of moderate to severe sleep apnea. But this is where many people misunderstand the test. A home sleep test does not record the same amount of information as a full sleep lab study. It usually does not measure brainwave, so it cannot precisely tell you when you are asleep and when you are awake. Because of that, it may underestimate the severity of sleep apnea in some cases. And if the sensors shift, detach, if the patient sleeps poorly, if the device captures incomplete data, the test may be technically inadequate. And one of the most important guideline points is this. If a single home sleep test is negative, inconclusive, or technically inadequate, then polysomnography should be performed for diagnosis. That means a normal home sleep does not always mean a normal sleep. That's the point we need to understand. If suspicion is still high, patient needs to have in-lab sleep study done. Should a home sleep apnea test be done initially for all patients? No. This is the most important practical message in this whole video. HSAT should not be used initially for all patients. It's not meant for general screening of people who have no symptoms. AASM position statement says HSAT should not be used for general screening of asymptomatic population. Also, not every sleepy, snoring patient is a good home test candidate. A full in-lab sleep study called polysomnography is better starting point if patient has more complex medical issues or have a concern for other sleep disorder rather than straightforward obstructive sleep apnea. Polysomnography is preferred over HSAT in adults with significant heart problem, lung problem like COPD, heart failure, coronary artery disease, possible respiratory muscle weakness because of neuromuscular conditions, awake hyperventilation because of severe obesity, chronic opioid medication like Vicodin or oxycodone, things like that, history of a stroke, severe insomnia. Also, if you suspect central sleep apnea, narcolepsy, unusual movement of your body during sleep, parasomnia, other complex sleep disorder, then a home sleep study may not be enough. In other words, HSAT is a good tool, but it's not one size fits all tool. Now, let's talk about the advantage first. Convenient. Biggest advantage is convenience. You sleep in your bed in your normal environment without having to spend a night in a lab, which could be scary. Lower cost. Home sleep testing often much less expensive than lab study, which can make evaluation more accessible. People have copay in these days, so that can make all the difference. And some people are not able to afford an in-lab sleep study because of high copay. Faster access. In many places, HSAT can reduce wait time and help get the diagnostic process started more quickly. I just had a patient yesterday. She was diagnosed about 10 years ago. She didn't like the machine. She didn't use it, but she started having cognitive decline. I saw her 2 weeks ago. I had sleep study done. I knew that she's gonna have obstructive sleep apnea. She have a severe degree of sleep apnea. Her AHI is 79. So I'm gonna put her on BiPAP. Now, other advantages of home sleep studies, is simpler experience. Some patients are uncomfortable sleeping in lab, and wires attached, several wires attached to their body, including head as well. It's useful for high probability of OSA. If the clinical picture strongly suggests uncomplicated OSA, it can be efficient first step. For the right patient, HSAT can be practical, efficient, very useful, and cheaper. Now, cons of home sleep study. We have less data than full sleep study. HSAT usually does not record EEG, which is a brain wave activity, so you cannot accurately measure true sleep time the way an in-lab study does. And it can miss milder or more complex cases. If the case is not classic OSA, home sleep test may miss the real problem or underestimate how severe it is. It does not diagnose all sleep disorder. If the technical error, sensors become loose, you're gonna get inaccurate data. And negative result may not end the workup. This is worth repeating if suspicion remains high and HSAT is negative or inadequate. Patient still needs formal polysomnography. Convenience is great, but convenience should not replace clinical judgment. So, is a bottom line. Home sleep apnea test is effective in selected patient. So, selection is very important. It's uncomplicated, moderate to severe sleep apnea. That's the kind of cases we are looking at. So, but no, HSAT should not be used initially for all patients. It is not a general screening tool for everyone. So remember this simple rule: right test, right patient, right interpretation. If you snore loudly, stop breathing during sleep, wake up unrefreshed, or feel sleepy during the day, talk to your doctor for a sleep specialist about getting evaluated properly. I'm Dr. PK. Follow for more clear, practical, evidence based medical education. Thank you for watching.